few things. Just firstly, a big thanks for coming and participating in this first session that we're holding in Sutton. We have got a number of other events planned, not just this week, but also in September. And these are only one way, I think, that we can sort of reach out and have a conversation, I think, with people about the most important things, I think, that that people might consider in relation to our ideas and thoughts at this point. I think as what was said at the beginning by Jeff, that this is still very, very early days in terms of the programme, that we want to build on these discussions over the next few months. Although we have an ambition, I think, to try and come together as CCGs again at some point in the late autumn to consider what might be then a formal set of proposals that we might consult formally with the public, and CCGs have a statutory role around consultation. We're quite some way, I think, from being at that point, and we'll want to reflect on the contributions today, but also the discussions going on in the two other CCGs as well as we go forward. But just thanks to Traverse and the programme team for helping sort of lead us through, both organise, set up and lead us through today. We have asked Traverse to do some more work with us, not just in terms of running these types of discussions events, but also working with the three health watchers to do some outreach work to some of the more hard-to-reach groups. I've asked Traverse also to think about helping us do some more structured conversations around aspects of the clinical model that Jeff and John talked about earlier, particularly around what it might mean if the location of services was to change for what we're describing as district services, but also urgent care and maternity and paediatric care, because I think that, particularly in terms of the latter, those are seen as really quite big changes if they were to happen. And we don't fully understand what people's views are about those elements. So there'll be work that goes on in September. The other thing just to mention is that we need not just to keep coming to church halls, but also perhaps to go to shopping centres and other places where we can give out information and get some feedback. And what we'll do is take people's views about the timing of these meetings. I think we've probably chosen the worst week really of the year, given how hot it is and that it's summer. But what I didn't want to do was let the programme just sort of rest on its laurels and then come back together in September and try and hurry everything through in September and October. So I'm glad we're holding some events in July, even though I know attendance will be difficult. Just a plug for the stakeholder reference group, which David Williams, who's to my left, very ably chairs, which is our, I think, attempt at trying to reach out again to a number of organisations and groups to get their views about, as we go along with the programme, about what some of the key issues and concerns might be. The two areas that I listen to constantly as being in these sessions about being probably the most important things: travel and transport, and we made a request at the stakeholder reference group. If there is anybody interested in coming to join some of the internal planning groups that we've got, then please let me know. You'll be really, really welcome at any of those sessions. So travel and transport. And then the other thing that I think is quite important to people is also about what the impact is on some of those harder to reach groups, which was not necessarily just going to reach in these types of events. So the programme board continues to meet. I know at the end of sort of September, when we've sort of concluded this first round of discussions, they'll be very, very keen to hear what those themes and issues are. They will then feed into any further deliberations that the governing bodies need at each of the CCGs. But it's good to be here and listening to what people have got to say today, and just a thanks again for all your input.
Okay, thanks, Andrew. So as I said, if you don't mind, please do give us your feedback. If you've got suggestions, we're finishing a little bit early. I'm just very conscious that you've been in this very warm room very patiently for some time. If you would like to if you have suggestions about engagement, do give them to your table facilitators. If you want to rush into the fresh air, then please do as well. Thank you very much.
For many years now in general practice surgeries local to Sutton. But I'm also here today because I'm one of the leads for one of the commissioning groups, so Sutton Commissioning Group. There are 3 CCGs that are deeply involved with this programme, so Surrey Downs, Sutton and Merton. And each of those CCGs have a duty to commission services locally with our trust, and we need to make sure that all the services that are local services that are running well. These services have national standards that they must meet, and we want to make sure that those services continue at the right level for those national standards. But locally, we've recognised there are 3 challenges, and some of those came out on the presentation today. One was around the quality and the clinical quality of our local services, making sure that they are safe, sustainable, and effective for the long term. That our estates provide the best care in the best facilities, and that as a system and as a local trust that we are financially stable, and that we help this to move towards a financially stable system. So this is really important for Sutton. In the next 15 years, the population of Sutton is going to increase by 10%. There's going to be a 28% increase in the number of residents that are over age 65. There's going to be a 34% increase in the number of residents that are over age 85. And the life expectancy of Sutton residents is greater than the national average. So we have to look at all those factors and try and understand how we provide the best healthcare in this region. So the programme Improving Healthcare Together 2020-2030, I think it starts to address these challenges. And our challenge is not whether we do this, but how we do this. I'll just go back to one of the documents and just read out a short phrase, because I think this says it really well. These 3 CCGs need to understand the views of people in Surrey Downs, Sutton and Merton, to include patients, their families, carers, NHS staff, and other key stakeholders. We're concerned about the future of our local acute services, and we want to make sure that we provide sustainable, high-quality acute services locally and within our budgets. So we're looking at what are these challenges and focusing on the elements of healthcare that the Trust has indicated we need to try and help most with. We've seen in the presentation about the major acute services and where we need to address those, particularly around our emergency care and our acute medicine. But the presentation also said that there are lots of things that aren't going to change, lots of services that are going to stay local to us. And it mentioned some of them, but actually there were more. These are the things that won't change: your primary care, your community care, your district nursing services, your urgent care units, your outpatients, your day case surgery, the post and antenatal care, imaging and diagnostics, and local beds at district hospital care on both sites. A long list of things are going to stay as they are. So I just want to make some commitments today to what we're doing. First of all, it's really important we involve the patients and the public in what we're doing. And this is our start of our engagement programme. And we have more to come. And this will be an engagement programme over a sustained period to make sure that everyone's voice is heard. We want to maintain, develop, and then make sure that there is a sustainable healthcare system that is high standard in our region. And we want to make sure that we've integrated our health and care system so that it works really effectively for our local population. We want to provide the best future healthcare services for Sutton. And the best quality of care then becomes available to all and not to some. I think there's plenty of opportunity to improve where we are, and this is the start of our programme for doing so. So I really appreciate those that have come today. I hope we have a really lively discussion, looking to hear for your views and feedback, and it's an important process that we need to get right for everyone that lives in our region. Thank you.
Thank you, Jeffrey. I'm just going to ask John Clark from the Excellence at Helier Trust just to give a couple of thoughts on that. I know that, as Jeffrey mentioned, the Trust and the CCGs work together quite closely, so I think it's helpful to hear from both. Here we go, John.
Thank you. I'll start blinded. So, my name's John. I'm one of the top microbiologists that work at Excellence at Helier. I've been there for 11 years now. So I'm the clinical director for clinical services, which is a kind of an old word, which actually is all of the bits behind the scenes. So x-rays, blood tests, physiotherapy, pharmacy, all of those kind of support services. And I've been asked today to come along to answer any questions that people may have specifically, but also to listen and take notes so we can go back on it. And I just really want to spend a couple of minutes just to give you the Trust perspective on this, because obviously we held events last year about, from the Trust side of things, what we were looking at. And really, I just want to sort of focus on three main points. One, buildings. It's no great surprise to know that St Helier's building is clad at the moment with scaffolding. I did make sure that the cladding that they're putting on is not flammable stuff. But all of that work that's going on at the moment, costing tens of millions, is simply to keep the rain out and to make sure that it's actually warm in winter. So we're getting a new roof for the windows. These are some of the original windows from 1928. So there's a lot of work with the buildings. The buildings are not how you would design a hospital nowadays. They were state-of-the-art back in the 20s, when everyone had TV, you had long walls with lots of open windows. But for now, for delivering modern healthcare, they're not ideal. And so they are costing us money every year to maintain and run. And so that's causing problems. And certainly moving forwards, were we to continue to use that building in its current states, we would be running into problems in terms of how we look after patients, prevent infection spreading, those kind of things. Touched upon very briefly, the second point is the challenges that trusts up and down the country have with delivering our modern healthcare and our standards, especially to our sickest patients. And it's no great surprise that within Excellence at Helier, a trust on 2 sites, we are struggling to meet some of those standards. Every hospital is running into problems with 4-hour waiting A&E, and actually I think something to be proud of. We're doing quite well at Excellence at Helier. But what we're having to do is utilise lots and lots of people in order to deliver that care. And one of the issues that we're finding, and you'll be reading in the press sort of the last few months and coming up in the next year or so, is that we're running out of doctors. And I don't want to mention the B word, but we rely very heavily on doctors from the continent, nurses from the continent to help power out and supply healthcare. So one of the issues that we may be running into is helping with staff to actually deliver this care. And so we've got to look at a model that allows us to utilise the staff we've got more efficiently and better. And as I said, junior doctors, training doctors coming through, the numbers are dropping off. So we've got a group of doctors who are retiring, not as many coming through. So we've got to look at how we work more efficiently and better. And then the third point, tied very closely into the first and second point, is obviously having to pay to fix your buildings, having to pay for additional staff, means that the trust is running an annual deficit, which means that we're losing money, we're not spending more money than we can. So sooner or later, we will be held to account by the government or Department of Health. So it's not sustainable in the long run. We want to get to somewhere that is delivering sustainable, high-quality care to the benefit of you. So I'm very interested to hear what you have to say today. I'm not sure if I'm moving or if you're moving, but please do come and ask me questions, chat, give me ideas. I want to jot stuff down to take back to the trust. But I was thrilled to be here. It's a real opportunity for me to listen to the public, because we're here to serve you. So thank you very much.
Thank you, John. It's really helpful. Okay, that is as much as we'll do of standing up here and presenting to you. Really, what we want to do is to hear your perspective on the issues. You've had an introduction. There's lots of information on your tables, and what we'll try and do is just to sort of walk through those issues. There are a couple of ground levels, things that I would ask you just to be considerate of. Firstly, in terms of your other members of the public who are here, I hope that everybody feels comfortable to share their views, whatever they are, and I'll ask you please to listen considerately, as I'm sure you would. We'll also try and capture notes on what's being said. Your facilitators might ask you for help with those. We might ask you to spell out acronyms for us, or to just make sure that we've captured what you're saying accurately. So please bear with us if we ask you to repeat things. If you want to broadcast your participation, you're very welcome to do so. That's entirely up to you. I just ask you to be considerate of those around you. If you want to take photographs or tweet, just be thoughtful about whether people around you are included in that. Otherwise, we'll leave you to your table discussions, and we'll start by asking a few questions about that case for change and whether that reflects your experiences and your understanding of the situation locally. So I'll hand over you to a table.